All right, this is Kate. She is my newest med student. So, sit up straight. We're going to go through so that she can, more or less, it's so she can really feel like the type of pressure that I'm using and some of the things I'm doing, because I talk everything through to her, but it's really hard to know what to do unless you start doing it yourself. So I'm feeling your iliac crest here. Mm-hmm. I'm coming around to the back. So when you see me doing the standing flexion test, go ahead and bend forward. Okay, come on up. And so our standing flexion test, do you remember what that tells us?
Which one's higher?
Which hip? Yeah, which hip we're going to treat. So go ahead and lay on your back. And so your left one, your thumb went way up there. So we're going to start. So this is, put your legs back down. So this is something that, how I do a shotgun to know if there's a pubic abnormality, you feel on the pubic bone. So you always use the palm of the hand and you feel for the pubic bone, and you feel right here, and you go on either side of that pubic bone, and you can feel if one side, like you feel how it's more painful here than this side. So you can fix the pubic bone, and this is what this is essentially meant to do. Go ahead and push your knees in. Good. And you're gonna pull apart. Good. And then push in again. Pull apart. Push in. And one more time. Good. Sometimes you hear a pop, sometimes you don't. It's just more satisfying when I hear it. So yours is actually lower down. So we're gonna bring your leg up. So I don't need to feel this anymore, but when I'm first teaching people, you put your hand down at L5 and you're gonna bring the leg up until I feel it get harder under my hand. So could you feel that change? Could you feel where, like, that's where your resistance point is? Mm-hmm. Yeah, so that's where you're going to. Go ahead and push your leg straight. And stop. You're gonna go ahead and push again. And stop. One more time. Good. Straight down. Now you're gonna recheck our work. That is much better. And then sometimes if somebody's having any pain in their leg, like I can check motion, like does she internally, externally rotate? Because the hip does multiple motions. Your hip, like your leg just doesn't go backwards and forwards. It internally rotates and externally rotates. So it's important to check those motions too if someone's having back pain, hip pain. You wanted me to check your neck?
No.
Okay, so when I'm feeling the first rib, it is in here. So you feel that? Mm-hmm. So yours actually are fine. So there's no issue here. Mm-hmm. So then we're gonna check. You have good motion in your neck. Do you have any pain anywhere?
Mm-mm. My pain is like here.
Okay.
Like a bump there.
So like here?
Yeah.
So this is your suboccipital. Okay. So what we can actually do, like, do you get headaches?
Sometimes.
Okay, so I have some patients who get tension headaches, and we can do a suboccipital release here, and it'll help. So you're going to come and drop your head a little bit off the table. So come closer. This is perfect. I don't think I've ever shown this before. Keep going. So I'm gonna turn. My thumb is right here, which is just in the suboccipital bone, here and here, and she's going to bring her head off the table, and I am pushing up and towards me. Just relax your head. You're gonna relax down, and I'm gonna hold that, and I'm waiting until I feel a softening underneath my fingers. But that's like, and really I can do one of two things. I can just leave it here, or I can do one side at a time and come a little bit over to her right until I feel it soften. And then I could come a little bit to the left until I feel that muscle soften. Or I can simply just be in the center and drop your head. There you go. Do you feel the difference between holding your neck up and dropping your head and just relaxing? So you always hear me tell patients relax. That's why. Because it puts tension on the neck. So really, if we were truly doing this, I'd have you actually bring your head off the table more.
Okay.
So you can bring it off more if you want to. Here, go ahead and drop your head more. Come scoot closer to the edge. So when I'm truly doing it, that's about the amount. Because you get so much more traction when you have a head that's down. So with your head being down, I'm able to apply more traction this way, more pressure this way. So, and you can feel the difference. And that will help loosen the suboccipital area. And that's something that you can do on patients yourself. Okay. Go ahead, and I'm gonna have you flip over. So one of the biggest things that I teach students how to do is myofascial release. So all my students are MDs. This is not something that they learn in medical school, but I try and teach them a few techniques they can do if they're gonna go into primary care. And so myofascial release is what I'm for if they just want to practice on family and friends. So we're gonna feel on your back. This is your significantly tighter side. So I am taking the palm of my hand and I'm doing a direct downward pressure. So it's more pressure than you thought, right? Most of the time it is. Keep breathing. Got to make sure that you follow through with the breath, because I can push deeper as you're doing a breath out. And really, by you taking deep breaths, it makes it easier for me. Okay, so I want you to pay attention to something. So I'm going to do this myofascial release, and I want you to pay attention to if you feel that muscle soften, and then I'll let you know when I'm feeling it under my hands, okay? Did you feel that little bit of softening? That's exactly what I'm feeling.
Okay.
On this side's not that bad. There's a touch of softening. Good. And then when I'm doing sacral rocking, you've seen me do this. I don't know if I've shown this in a video yet, but I'm putting the base of my hand here at the base of the sacrum, and I'm pushing in to try and get the sacrum to move a little bit. And it'll just kind of help movement of that. That's not bad. Your upper back is way more tight. Your lower back kind of is. So go ahead and sit up. So thoracic vertebrae can be stuck in a flexed position, so this way, or an extended position. Yours are more an extended position, so this is what I do when I have a patient who's extended. So go ahead and put your arms on your head. And I'm going to bring you back. So you're going to take a deep breath in, and then we're just going to relax back. And try and bring them into extension. Okay, go ahead and sit back up. And then I can recheck. That feels better. How does that feel to you?
Feels good.
Good. Go ahead and stand up and see overall how you feel. I don't know if you had any pain when you came in, but. So then we can recheck. Go ahead, Kara. We can recheck that standing flexion. Go ahead and bend forward for me. And that's all better. All right.